A lot of the perspective that I take with families is do your own family assessment in terms of how is it that you're raising your child. I like to look at, with families, family backgrounds, who's living in the home, what are the values, what are the morals that you have in your home, and then determine their own level of comfort with their child's developing puberty, their child's developing independence, and yes, even their sexuality. Try to be patient with your children. They're not going to necessarily get it on the first time. I try to, piece of that is explain to families, assess what you already do to role model for your child. So do the parent and the adult figures in the home, do they cuddle, do they hold hands, do they hug each other, do they share words of endearment? Hopefully there's already setting some boundaries in terms of what they're doing with their own relationship issues within the home. That's part of early learning for the child. I also tell them you can't go up to a 14 or 15 or even a 13-year-old having never talked to them about sexual activity and whatnot, and all of a sudden say, oh, by the way, we're going to talk about sex. You have to integrate it and slowly build into it. And then if the child says, I don't want to talk to you about that, that's fine. Acknowledge that for the teenager and say, okay, so let's find some way to get you some of the education. I try to get parents to understand and remember when they were teenagers themselves that it's not an easy topic to talk about in terms of what's happening with their bodies and the changes of their bodies. A lot of it is, with a child with developmental disabilities, is the message is going to be more limited. It's going to be maybe more frequent episodes of trying to educate the child in shorter spans, where other children may learn for less frequent but longer periods of time. There's also a lot of visual and physical aids that can be done in order to teach kids with developmental disabilities, such as the Circles program or Life Facts program, so I do show that to families as well. Start with what does the teenager or the child already know about that's happening with their body development. And understand that if the child is saying, I'm not comfortable talking to you about that, don't take it as a sense of rejection. It's actually good and healthy that that teenager is saying, no, this is a boundary that I'm setting, that I'm not comfortable talking to you about these topics, because they're trying to develop that own level of independence for themselves.